On the day of your operation, you will read and sign the consent form. If you have any inquiries, please feel free to ask. The doctor will make an eye examination once again, just before the operation. Your face must be thoroughly washed, and your eye will be disinfected by the nurse. Preoperative antibiotic prophylaxis will be given to decrease the risk of postoperative infection. Medical treatment expense can be paid by cash, credit card, or QR code. Just before the surgery, you will be given paracetamol tablet to relieve postoperative pain and Valium tablet in order to reduce anxiety. The nurse will disinfect your facial skin with povidone iodine solution and apply numbing eye drops to make the procedure comfortable and decrease your urge to blink. Once you have been prepped, you are ready to head into the laser suit. You will be lying down on a cushioned surgical bed. Microkeratome-based Lasik or blade Lasik. The lids of the treated eye will be supported and kept open by a small ophthalmic device. It does not cause pain, but only mild sensation of pressure around the eyelids. You will be asked to open both eyes and focus on a green target light. It simply helps you to maintain the direction of your gaze during a treatment session. You can also blink both of your eyes during the surgery. The doctor will use an ink marker to mark the cornea before creating the flap, in order to make sure that the flap will be unfolded properly. Microkeratome blade will be applied on your cornea. This is the part that may cause some discomfort. Many people report a sensation of pressure during this part of surgery. You can also expect a temporary dimming in your vision for about 15 seconds while corneal flap is created. Then, the doctor will lift the corneal flap and the excimer laser gently reshapes your cornea. It is guided by a computer that has mapped your eye preloaded onto it. During this treatment process, you will be aware of new smells and sounds originated from the operating laser. After the excimer laser finish, the doctor smooths the corneal flap back in place. Your eye should be kept steady for about 2 to 4 minutes to ensure the flap attachment. Femtosecond laser Lasik or bloodless Lasik. An eye speculum will be used to keep your eyelids open during the procedure. You will be asked to open both eyes and focus on a purple target light. A suction ring is then centered over the pupil, and suction is applied. A glass lens to hold the globe of the eye steady and flatten the cornea. You may feel a little bit of pressure during the procedure, but you won't feel any pain. The laser pulse to create a corneal flap around 6 seconds, and suction is released. Once the flap is peeled back, a precise excimer laser will reshape the cornea as required to resolve your condition. You may hear a ticking sound or smell something burning during this part of the procedure. Then, the corneal flap is replaced once reshaping is completed. Photorefractive keratectomy or PRK. An eye speculum will be used to keep your eyelids open during the procedure. You will be asked to open both eyes and focus on a green target light. You can also blink both of your eyes during the surgery. The excimer laser sculpts the corneal tissue to reshape corneal surface in order to correct your eye condition. The doctor will apply a chemical substance on the ablated corneal surface to lower the risk of postoperative corneal haze. At the end of procedure, a contact lens is placed over the cornea to promote wound healing. After the operation is completed, your eyes will be rechecked again by the doctor. You will also be given an antibiotic, anti-inflammatory, lubricating eye drops, and eye shields, post-operative eye drops, or home medication. For Lasik procedure, paracetamol for pain relief, sleeping pills, and gauze for wiping your tears. For PRK procedure, paracetamol for pain relief, sleeping pills, artificial tears to reduce an eye operate. For PRK procedure, paracetamol for pain relief, sleeping pills, artificial tears to reduce eye irritation, and gauze for wiping your tears. Post-operative instructions. You are allowed to do routine activity. Avoid rubbing or squeezing your eyes, especially in the first 6 hours, in order to protect the corneal flap. On the day of surgery, your eyes may burn, sting, and tear excessively for about 6 hours. Try to take a nap during this time. You will wear an eye shield for the first 24 hours after the procedure to prevent scratching or rubbing your eye and dislodging of the flap. A subconjunctival hemorrhage caused by the corneal suction ring may appear as a bright red or dark red patch of the eye. This is no need to worry. This condition will not affect your final vision and will spontaneously disappear within 2 to 4 weeks.